Hi Frank, I'm Ashley. I'm going to be your PT today. I'm just going to start by asking you a few questions. How did you get this wound? When did you get the wound? Do you have any pain? Have you tried anything at home to treat your wound? Have you been treated for any other wounds in the past? And now I'm just going to go over your medical history with you and just let me know if I have everything correct. So I see in your chart that you are receiving treatment for prostate cancer, diabetes, chronic venous insufficiency, bilateral hip and knee OA, and had a coronary artery bypass 1 year ago. So the diabetes can affect wound healing because it'll affect the blood vessels, bringing the blood and nutrients to the wound, along with having impaired sensation, and there is a higher risk for infection. The treatment for prostate cancer can also suppress the immune system and impact blood function and just slow down the healing process. With the chronic venous insufficiency, basically the veins aren't working properly and can cause white blood cell buildup on the skin and can lead to ulceration. And the history of coronary artery disease can also impact blood, oxygen, and nutrients to the wound, which could affect the healing process. So now I'm just going to go over your medications. So I see that you are taking docetaxel, insulin, metformin, Celebrex, aspirin, Zocor, and lisinopril. So the metformin and insulin are to control his diabetes. The docetaxel is a chemotherapy drug to treat his cancer, and this can decrease red blood cells, resulting in decreased oxygen, nutrients to the wound, decreased white blood cells, which can increase the risk for infection, and there can be a higher risk for bleeding. The Celebrex and aspirin are both non-steroidal anti-inflammatory drugs, which can affect blood to the wound and increase risk of infection, and can also impact the strength of the new tissue. Aspirin is also a blood thinner, so again, there's an increased risk for bleeding. The Zocor is a statin drug, so that will help treat high cholesterol. The lisinopril is an ACE inhibitor, which causes vasodilation of blood vessels and decreases blood volume and can delay the wound healing. Okay, so for functional mobility and lifestyle habits, Frank is a retired college professor who lives with his wife. During the day, they watch their 2 grandchildren while their parents work. Frank, despite his past medical history, is fairly active with his grandchildren. They enjoy going to the park, gardening, going to the beach, and riding bikes, although he may get tired at the end of the day. He discovered the wound while putting his boots on 1 week ago. His granddaughter noticed it when he was putting his socks on. He states that before that he found the wound, he had no difficulties participating in his daily routines. The patient does not report a lot of pain. So how can this impact his future functional status? The patient seems very motivated to heal his wound so he can go back to participating in the activities with his grandchildren. He reports that he has been managing his diabetes and heart disease and will comply with doing routine skin checks. Due to his physical activity and being on his feet a lot with his grandchildren, this could impact the wound healing, so it is recommended that he offloads the foot as much as possible to decrease stress to the wound. Okay, so now I'm just going to go through a systems review. So for the cardiovascular system, it is within normal limits. His blood pressure might be slightly elevated, but the ACE inhibitor should be controlling that. His pulmonary system is within normal limits, so his oxygen and respiratory rate. His musculoskeletal, his range of motion is within normal limits. He might have some decreased weakness, just due to generalized weakness in his age. And there seems to be an amputation of the great toe. For neuromuscular, I would do the monofilament test, hot and cold testing, deep and light touch, vibration perception threshold, and due to his diabetes, I do suspect that there might be some sensation deficits. So for gastrointestinal, I would ask him about his daily food intake to make sure there's no malnutrition or dehydration. For integumentary, the skin on the plantar aspect of the foot does seem a little dry, and there could be possible hyperkeratosis. Okay, so now I'm going to examine the wound. The wound is on the plantar aspect of the right foot. It's by the base of the second and third metatarsals. I'm going to measure the length of the wound. So I'm going to take it from the longest point. And it seems to be 4.5 centimeters. And then for the width, that is about 2 centimeters. So the total surface area is about 9 centimeters squared. The wound bed appears red and pink. The wound seems a little dry, and there is possible hypogranulation tissue, so not enough in the wound bed. And I would say that it's 100% granulation tissue. The wound edges are uneven. There's also yellow skin all around the wound, which could be callus formation. And there is some white skin between 6 and 9 o'clock around the wound edges. For the peri-wound, there is black, possibly necrotic tissue where the great toe would be. And the area around the foot seems very dry, and there could be some hyperkeratosis. And the exudate type is serosanguinous because it is a light pink exudate with minimal amount. And so the diagnosis for this wound would be a neuropathic ulcer.